Hi, my name is John Edwards. I'm a board-certified neurosurgeon at Summit Brain and Spine. In this video, we're going to discuss the question, what are my restrictions after surgery? The most common question asked in clinic is, what are my restrictions after surgery? I think what patients are really asking is, I'm risking a lot to undergo this surgery and I don't want to mess it up. They are also asking, I want my life back, but when will that happen? Historically, patients have been told not to lift, twist, or bend for an arbitrary length of time after surgery. Recommendations like, don't lift anything heavier than a gallon of milk are common. Restrictions have been implemented for 1 month, 2 months, and even 6 months, and patients have been instructed to expect lengthy periods of worry and recovery. One instruction sheet I reviewed specifically listed 15 things not to do. Another instruction sheet was 36 pages long. I personally became anxious and overwhelmed in my study of what is out there. We have discussed this with our colleagues during our weekly interdisciplinary conferences. Our recommendation takes into account a delicate balance. The balance between the need for injured tissues in the body to be appropriately stressed to heal and their vulnerability to additional injury. It also takes into account your need to restore function as soon as possible after surgery. Our recommendation is to focus on mindfulness and mindful movement during the postoperative period. According to John Zinn at the University of Massachusetts, mindfulness involves purposefully paying attention to what's happening in the moment without judgment. It includes acceptance of your circumstances, as well as the ability to relax and even enjoy the present. It's a mental state achieved by focusing one's awareness on the present moment while calmly acknowledging and accepting one's feelings, thoughts, and bodily sensations. I want to tell you from a personal experience another way of thinking about mindfulness. I personally like to ski. My teenagers ski really fast. And when I ski with them, it's all about keeping up with them, going down the mountain at what seems like sometimes 100 miles an hour, and hopefully they are not crashed at the end of the hill. My 8-year-old, though, does not ski particularly fast. When I ski with him, we ski on the green runs and sometimes the blue runs. I slow down. And I have found I can enjoy skiing with my 8-year-old, even if I go slow, by being in the moment and enjoying and paying attention to every turn and every movement of my body. I think that is an example of mindfulness. It's slowing down and paying attention. And as you build up strength and reserves and ability during your postoperative recovery, you graduate to increasing speed and steepness down the ski slope or whatever it is you're trying to advance to. Tuning into your body can make you more resilient too. Resilience expert Linda Graham writes about how mind-body awareness can be a source of power and assurance in moments of self-doubt. Nearly every patient experiences doubt and fear going into surgery. By focusing on the way our body moves, there is a subtle, empowering shift. Our body position can affect our mental state. Control and focus can empower our mental well-being. Postoperative pain and discomfort is accepted and dealt with effectively and safely. The rate at which you advance to increasing levels of function is not determined by arbitrary timelines, but on what your body is telling you. All patients experience setbacks and bad days. This mindset accounts for this and allows day-to-day adjustments. In preparation for surgery, I encourage you to study and practice mindfulness and mindful movement. Take the opportunity to disconnect from outside distraction and reconnect with your body the wonderful ways it moves and functions, and what your body is telling you to do to get your life back.